it's got different, what do they call it? Infusion oils in it to give it a flavor. Nicaragua, big company. They probably one of the biggest cigar companies in the world now. They have like 50 different types.
Now you got them. Now you got them talking about that. We're recording now, and now you got them talking about cigars. Okay, everybody. Welcome back to Your Crisis Coach with Scott H. Silverman and Fred Carroll. Today we're going to talk with Dr. Mike Barnes, and we're going to ask him the first question. First of all, tell us who you are and welcome to the show.
Well, thank you for having me on the show. I have been in the field for 42 years and started in Sarasota, Florida. And my last major position was with a program in Steamboat Springs, Colorado, where I was the chief clinical officer. And I really wanted to, I'm still with the parent company. I'm like an advisor to the treatment side, but I run the Michael Barnes Family Institute, which is a program for treatment, educating counselors, and research.
Mike, just to be clear, because when people, I like to joke about it. When you say you're in the field, you're obviously not a corn farmer. So which field, just so people know, people like me with small brains, because people may not know you, and we want them to get to know you. So specifically, if you can't just break it down a little bit, because we hope to have people that listen to us that have no idea what to do with a loved one who's going through a variety of different things. I mean, we've got your bio, but for those who don't, what field are you in?
I've been an addiction counselor for 42 years. I've been a marriage and family therapist and trauma therapist for 31 years, I think. So, grew up in a family with addiction and then got interested in that way, and then had a pretty major trauma with our son that really shifted my focus into studying what happens in families when they have a catastrophe. And that then kind of bled into wow, there's not that much difference between what families with a major trauma experience and what families with addiction experience. And so I just published a book called When the Solution Becomes the Problem, helping families struggling with addiction and trauma. And people always ask, well, what does that mean? And it really means that families do the most incredibly difficult adjustment to try to live with, support, love their loved one. And that as the addiction progresses, the efforts that they make create a new normal. And that new normal becomes problematic as their loved one attempts to get sober. And because the client starts to get well, but the family stays stuck in a very hypervigilant, controlling state, often, not always, but often. And that's really where I began to look at the trauma piece, from everything from enabling, which I don't like the term very much, but the principle is there. I think that's primarily a trauma response in many ways. And so, those are all things that...
just recently, sorry to interrupt you, but just recently on 60 Minutes, they talked about PTS and how the individual who goes untreated will infect the entire family. And I'm sure a trauma, you would agree, I hope you would agree, does the same thing, that if somebody goes untreated, their behavior, for lack of a better word, bleeds over to the entire family. So, and I'm a person who believes that addiction is a disease, and untreated, it gets worse, and it's a family disease, and everyone in the family has a role that they play. And you've already shared that you had it in your family. So, and it's amazing. You said you 31 years working with trauma. I mean, I don't think the term was really even popular, if you will, untreated trauma, unless you were really succinctly focused on it with people who suffer from, either behavioral health issues or from addiction or self-medication, because people didn't talk about it. Basically an abstinence-based traditional 12-step recovery is, you don't do this and you do this and you're going to be fine. Well, my colleague describes it as you get sober and it's like driving a station wagon. You hit the brakes and everything in the back just comes rolling forward.
I love that.
And I agree with that. So talk a little bit about that, from a family dynamic perspective, because clearly you've been doing this to a point where, you have a much probably broader understanding, even an addiction psychiatrist, because they, I have my client, I don't do the family thing, and they may be getting some tools, but if the family doesn't get the tools, it's like trying to rotate tires in the dark without lug nuts.
Yeah, I was very fortunate. My doctorate was paid for by the Agent Orange class assist, or the lawsuit. And I worked in the Vietnam Veteran Families Project for 4 years while I was in my doctoral program. And my mentor was a guy by the name of Charles Figley, Dr. Charles Figley, who wrote the first book on Vietnam veterans and PTSD. And he coined the term secondary trauma. And it really is saying that living with someone who has those kinds of symptoms, the hypervigilance, the control, the dysregulation, the recurring nightmares and the intrusive thoughts and all of those things, that while the loved one who has the post-traumatic stress disorder is responding to memory or to the experience of the event, the family members have the exact same symptoms. In my research on the secondary trauma of parents of kids that got hit by a car, like our son got hit, that they had the exact same symptoms as the primary trauma survivor. Exactly. And so the diagnostic and statistical manual, DSM, basically says you can be traumatized by being involved in an accident or an event that's life-threatening, witnessing it, by learning about it with a loved one, or being in an environment where you're consistently experiencing the consequences and the symptoms of trauma. And to me, that's every family I've ever worked with who had a loved one that struggled with addiction. That
I think, building upon that, I saw that 2 Parkland surviving students committed suicide this week due to their traumatic event. And I think that's what you're kind of saying, is that the trauma comes from different angles, and there seem to be survivor's guilt.
Well, for those kids,
learn on your own. Someone has to teach you that. It's not something you just wake up one day and go, "Hey, Bobby, I've got survival skills today." It doesn't happen like that. It's got to be taught, and it's got to be learned. It's got to be practiced, and you have to be able to interact with someone else to know if you're on the right track or not. Am I correct with that?
Yeah, absolutely. First responders commit suicide at very high rates as well. Those of us that, kind of, while everyone's running away, the first responders are running towards the danger, and their rates of suicide, their rates of addiction. So there's no question in my mind that there are co-occurring disorders. And, I've done some research that we found that 30% of our clients in the addiction, residential side have pretty certain diagnosable PTSD. Another 30% have developmental, grew up in a family with transgenerational trauma, those kinds of things. And it's interesting that when I got to the treatment center, not my last one, but the previous one was a pretty big medical center with a lot of psychiatrists. And I went back and I looked at every admission the previous year to see how many people had been diagnosed. Not one. 0. And so I had to kind of teach the psychiatrists, hey, this is a real situation. We need to be addressing it a little bit more. And by the time I left there, it was pretty significant shift.
You know why that is? I have a guesstimation of why that is, but why do you think that is?
Well, number one, there's no medication for it. So there's nothing you can, there is, I think, Prozac's the only FDA approved medication for post-traumatic stress disorder, but that doesn't do much. The other is most insurance companies believe post-traumatic stress disorder should be treated on an outpatient basis.
Yep. And it's not benefits rewarded, so it's not a practice that people do. And generally, when if you've done res, you have people, you have them for a finite period of time, and that finite period of time is cut in half from where it was 10 years ago. So when you think about it, you've got a week to detox somebody, stabilize them, a week to let them know that this today is Monday, and then, start to interact with others. And, if they're cognitively capable of anything, all they're realizing is the horror train they've been on for so long. And then, you pack them up and say, here's a list of meetings in your area. Good luck. And gee whiz, try to get involved with our alumni, which we hope to start next year as soon as we get funding for it. So it's like, $45 billion industry, $45 billion industry, the treatment industry that I'm proudly a member of, not proudly, embarrassed by it, and a 95% relapse rate. And I don't care where you go, or how long you're there. If when you leave, if you don't have a pathway and some sort of handoff, soft or hard, you're going to more than likely relapse. That's this disease of addiction. And we would never let a heart patient leave the hospital without tools. My wife broke her hip last, year. PT's following up. She's, 6 months past post-op, and they said it's going to be another 6 months, maybe a year. And, there's shifts you have to make, tools you have to get. And, that's a physical thing. There's trauma around it, but not compared to someone who has trauma and then, then wakes up with realizing, oh my, I had headaches, and now I have migraines, and now I can't sleep, and I have no relationship left. And I love my significant other. We get along, but I can't have a relationship because, I don't have the tools. I don't know how
so
to do it.
What is some of the solutions then to change the balance there? Where, if we keep doing this year after year, the 95% doesn't change. How do we change that 95 to 90 just to get it better, to get it to 85? Do you have a solution? Do you see a future?
Well, I found a paper that I had written in 1991 when I was cleaning out my garage during COVID. And it was a paper about addiction and families. And it was a paper that basically said that we need to not have family programs. We need to infuse families into the treatment process. And since I was the chief clinical officer, I decided I was going to take some time and I was going to write the program that I wanted to write. And we've been doing it for 4 years. And it's based on, and Scott talked about the disease concept. And I took that a step further and said, it's, really looked at what is the medical environment doing for people with chronic illness? And one of the things they're doing is they're doing coaching, education, and support for families, but they're also shifting families away from we're a family that supports a loved one with addiction to we're a family in recovery from addiction. And that's the change that I'm really working on. Everywhere I speak on this, that idea that it can't just be simply about support, because you can't give people what you don't have. And it's just like you said, Scott, the idea of if the family's as traumatized as the client is, and the family is just as hypervigilant. I started looking at what I call the parallel process of families in addiction, and the idea that everything from perceptions, beliefs about the illness, is it a disease, is it not a disease, is it a weakness? Families wrestle with that every bit as much as clients wrestle with it, if not more. Acceptance. Is the diagnosis right? Do I really have it? Do I have to go through all this stuff to do this? Clients have it just as much as their families, or the families have it just as much.
So if I'm understanding you, I think what I'm hearing is I'm the addict, an alcoholic in my family.
Mm-hmm.
My wife, instead of just supporting me, needs to really work on her, which is what happened for us. And we were very lucky. And, we've been together over, just 42 years this year. And part of what happened was that she was told she needs to go get her support and I need to go get mine. And then at some point we can come together and work together. Mm-hmm. And so I like the way you framed it, because it's pretty straightforward. It's pretty simple. I don't know. We're doing it now with our veterans program, Veterans Navigation Center, which is a nonprofit we formed to kind of pigtail back of once the benefits sunset, we transition our vets over to that. And we're going to try to bring the family in. And there's more, I think, in TRICARE for families than there is in TRI-West, which is veteran-based benefits. Yeah. And we're in San Diego, fourth largest veteran community in the country. And half our veterans don't even have insurance. because they don't want to go to the VA, or they've had a bad experience, or they're, did you mention, are you a veteran, by the way?
I am not. I
Just
am
work
not.
with.
I just happened to get to Florida State University at the time that they got this grant. And with I had come with 8 years of experience as a therapist, and they very quickly moved me into that assistantship. But
Well, you saw the trauma, the PTS for veterans.
yeah.
It's amazing, the level
And
of
their
depth
families, and their
and the
families.
families.
So the one thing I want to interject is Scott does this every week where he mentions his alcoholism and stuff, but he fails to mention that he's 40 years sober every time. I don't know why you said you were embarrassed about one thing, but you're not proud about that.
Are you talking to me, Fred?
Yeah.
Well,
Where's the pride?
I don't tell people I'm, 30 pounds overweight every week too, and I don't tell people my hair's thinning and I've got diminished hearing, and, and I'm on Medicare. No, in certain environments, I mentioned I'm in long-term recovery, and, it is an achievement, but I also know that when I was first sober and I've heard people say things like that, I always thought they were making it up to try to engage me. Because to me, and I believe this, that if we can find a way to live each day, 1 hour at a time. And when I learned about mindfulness, because everyone, oh, you need to practice mindfulness. And then I found a shortcut because I like the easier, softer way. And that is learning how to live a minute at a time. And in recovery, it's just like, thy will be done, not mine. So I try to find shortcuts. My first day in treatment, I asked if they had the big book in video, because I said, I can't read this book. Do you have it in video? This is back in the 80s. So, we still had VCRs and things like that, but they didn't. And then everyone said, oh, you got to read the book. There are certain tools that work, but I've also learned, to be candid, there are things in the recovery portal that don't help with untreated trauma. They don't help with behavioral health issues. And I've seen people, law enforcement, that was my primary client when we opened up Confidential Recovery 10 years ago. It's our anniversary this year in October. I can't tell you how many times I've heard a law enforcement officer say, I would rather eat my gun than ask for help. I would rather take my own life than be embarrassed about a mental health issue. And I just find that, sad. It's just like that's sad. That is treatable. That's avoidable, and we should be talking about it. And I like the way you nicely, softly, gently mentioned the family, Mike, because I think you're absolutely right. They get forgotten, and I've been talking about the opioid crisis, and I read a piece the other day. 42% of our adult population in this country, 42%, know somebody who died of an overdose. I mean, it's like,
yeah,
the number's north of 400 now. It's two. When I started this, it was one plane crash a day. Now it's two, and nobody's talking about it. And the new laws coming out that the government just approved, and I'm going to be speaking on it this week with some media stuff. And they asked me today what I thought about it. I said, it's the same thing. It's criminal justice trying to arrest their way out of this. And, and every time somebody gets arrested who gave their buddy a pill and they get put away, the person who made it and gave it to them, they're not getting caught. They're not getting put away. And, so to me, what we're doing ain't working, and I love that saying, do what you've always done. You get what you've always gotten. A true definition of insanity. So, this, and I keep telling people, government's not going to fix this. We are not going to be able to, I don't care what side of the aisle you're on. Government will not fix this, just like they're not fixing homelessness. They're having a real hard time with, the environment. They're having a hard time with healthcare and people, and giving people the ability to live a happy, joyous, and free life. So I don't look to the government for anything anymore, even though I work closely with the VA, and they have a $230 billion budget, and their failure rate's probably just the same.
Oh yeah, yeah. It's interesting. I was back home in Pennsylvania. I grew up central Pennsylvania, and they were having their kind of addiction awareness day, and my sister called and said, "Hey, why don't you fly in and you can speak at this thing?" And it was on the steps of the courthouse. Really kind of small town America. It was really cool. And there was a guy there, and he came up to me afterwards, and he said, then he's a state representative from Pennsylvania. And I said, oh, well, great. Nice to meet you. And he says, I was listening to your presentation, and we just wrote a bill to address addiction that will pass. And he said, the word family is not mentioned in the bill at all. I said, well, that's not very surprising. That no one thinks about the family except the family. And so, I think about when our son got hit by a car when he was 5, and life threatening. He was never supposed to live the night. And there was a time where we thought we were doing okay. And then just, the silly little things. When my wife said, hey, do me a favor, go get the newspaper. And the newspaper, he got hit right in front of the mailbox. And I said, yeah, I'll get it. And he said, he was now 7 years old. He said, I'll go get it. And my wife went, no. Your dad will get it. He said, what do you think I'm going to do? Run out in front of another car? It was an accident. And I looked at my wife and I said, he's the healthiest person in this family. That you and I need to get we need to get some therapy. We need to figure this out. Because so often what happens, if I have a young guy, 22, 25, 30, and they're just failure to thrive, they just haven't done anything, they failed out of college, or they may have graduated by the skin of their teeth, but they just never really grew up. And I'll always ask those guys, so who died or almost died in your family? And they look like, how do you know that? I don't know anything. I just know that when people have trauma, they often have a kid that doesn't succeed very well. And so I started really looking at the difference between rehabilitation, which we all call addiction treatment, and habilitation. The second one is habilitation.
Habilitation.
Yeah, we assume that we're going to rehab you. That assumes that you have the skills. You learned the skills at one point, and the addiction just sort of, hijacked that. But so many of the young guys that we work with have never gone through all the developmental stages necessary to be able to be adults. And I was talking about it on another podcast, and I got a call from this 38-year-old guy. And he said, I've been in treatment 15 times, and I relapsed because of exactly what you said. I'm terrified if when I get sober, people realize how incompetent I am. I've never paid my rent. My parents have done all of these things for me because of, he almost died as a kid. And so this is where the trauma is every bit as important as just understanding the addiction piece. So often I think clients, it's like you said earlier, they become addicted as a self-medication process because they never developed. So I just think it's more complicated than people think. It's not a simple, you just get sober and then you do trauma work.
Well, it's not only in the trauma, it's in the addiction side of things. Yeah. We're taught at a very young age, whether maliciously or just overhearing, the alcoholic is a worthless drunk, that's a drug addict standing on the corner, stay away from them. We're taught that they're bad people before we're taught that they could be good people. And that's a problem, but it's still a cautionary tale. Obviously, there is danger involved in approaching somebody that is under the substance of anything, but it shouldn't make them any less human. And that's where we're failing.
I go to 6 meetings a week on Zoom, and I know there's science behind this, and I think about it now every other day. When I introduce myself as a drug addict and alcoholic. And that's not real positively uplifting because it's a cautionary tale, and I need to really balance. And I think I have, but people that are new, I mean, that's to me, that's negative reinforcement. And according to the big book, it's supposed to be a way to remind yourself that you're broken. So, and that, you heard me, I use the word PTS. I don't even like using the letter D for disorder there. I think it, the stigma behind this, I heard a guy speak just couple of months ago, the big homeless advocate, how, you go to the hospital and you have a problem. They put you on a gurney and they go to work on you. Go to the hospital and you're drunk or inebriated. You are treated worse than the enemy. There are some people that are sensitive and they might not have an issue with stigma, but it's treated. The maladaptive behavior is treated completely differently than any other disease. And I like to compare it to diabetes, because when someone has diabetes, you get checked, you get monitored for the rest of your life. And for me, that's a simple way to do it. And I think you're right about the family. When I hear people say, well, I'm going to love my son to wellness. And I'm thinking, well, how old's your son? Well, he's 47. Where is he? He's still living with me. So how's that working for you? And if it's not, can we look at something else that might? Because here, their life, they're worse in some ways than their son, because they have devoted every waking hour to make sure they're okay. Even when they're sleeping, they're worried about their son waking up and going out. So they don't go to sleep, which means
so Mike, what happens when one or more of the parents aren't on board? Well, you say bring the parents in. You can't force them into this. Are most of them buying into it?
It's funny. I just had a conversation with a wife of a client today whose husband wants no part of this. He had stage 4 cancer, and his kids were pretty traumatized, thinking, the worst. And he wants no part of being reminded of all of that it's not my fault. I didn't do this. So I take an old school systems approach. And that is, if one person in a family begins to change and is fully committed to change regardless of what anyone in that family says or does, the family has to either A, jettison them out of there, or they have to begin to adjust to this person who's new. And for this mom, she's doing fabulous. She's really working on herself. She's doing everything that you would hope that she would do. And I said, don't worry about your husband. Just love him. And he's not in recovery. He's in recovery from his cancer. But and you just continue to grow and get better and keep doing your thing. And you never know. He might just swing right around, because he has very little choice other than because you're different. The way he interacts with you is going to have to change. And so
that's interesting.
I always think about a mobile, and in my presentations, I have them all over the place, but like a mobile over a baby's crib. And if one part of that mobile shifts, the other parts don't have much choice but to shift to try to regain balance. And that's why I say, people say, well, what happens when the whole family doesn't come to treatment? I said, well, then we have one person who's really committed, if they're really committed to change. And I have a whole chapter in my book on it about this idea of, these are the things that are required for change to happen, and that your family members are paying attention. Like, they may not be talking about the changes that you're making, but they're noticing. They may not like them, and it's funny. This is my beef with individual therapists and trauma. They never talk to their family. They never talk to their client about how are things going at home, because this person now is beginning to show life, is beginning to get better. And the research would say that the family isn't quite so quick to make those shifts. And so,
there's science around the fact that, I know this interventionist has been at this for decades, and he shared a story once that he believes 70% of the relapses are stimulated by family members. You go away to get help, 6 months, 90 days, 30 days, a year. You come home, and dad, usually it's a dad, says, "Okay, it's time to go to work." I mean, you've been out of work for 4 years, and you could go for an interview tomorrow. I'll take you. And the mom's like, "Can he hang out for a couple?" No, he's got to go back to work. He's got to get a job. He's got to go back to school. He wants to have a family, and and all the trigger words are all going off in the kid's head. And before the sun sets, he's back out again. He goes, I didn't go away to get help to come home to this. So you're right. The family and probably I try to talk about it whenever I can because I'm sensitive to it. And I believe that, I'm not a clinician or a doctor. So, I don't know if what I say is taken differently, but experientially, there's studies that around, from a guy that I know, he's the head of the psych department at UCSD. He says the family that has dinner 3 times a week together as a family does better than any other family, just simply because they're sitting down together, and not when the disease is at its peak, but as the family grows, and you can check in with each other, and you can find out if junior's developing, and the government's going to lower the grade of criminality for marijuana, and it's the THC is so high now, and we're going to see kids, that peak age of 15 to 20, they're not going to develop on marijuana, and I know from my own experience that you stop growing emotionally as soon as you start anesthetizing yourself. So if you start drinking and using at single digits at 9 and you get sober at 35, you've got the maturity level of a 9-year-old.
Well, and how many clients say, well, I don't think I'm going to go to IOP. I'm just going to go to some meetings and I'll figure it out. And it's like, the chances of that happening are so. Now, I love being shocked. I love being. I had a guy come up to me not long ago that said, "Do you remember me? You were my." I went to the Foundry, and he said, "I really struggled, but I'm doing it. I've been sober for like 5 years, and I love it." But the odds are really against that being the case, and so you're familiar with the term compassion fatigue, I'm sure, and we talk about it as the burnout and secondary trauma. Think of I've been speaking a lot about that families have compassion fatigue. And burnout is about operation, the rules and roles and routines. And if you think about how when a loved one starts struggling with addiction, the family's doing all of these changes to the rules and the roles that people play and the rituals like having dinner that all kind of go haywire and are kind of reevaluated to maximize the likelihood that we're going to be able to keep this ship sailing. And so we do two things. We create a way of interacting as a family that allows us to support our loved one while also learning how to live with our loved one who's using. So that's the burnout piece, that over the course of time, families just get exhausted and they get disillusioned and they're blaming each other. And it's what I call systemic trauma. But then there's the secondary trauma that is also part of compassion fatigue. And they've certainly got that as well. And so I think it's a useful concept because families like to hear that they have compassion fatigue rather than secondary trauma. They can wrap their head around that.
Give yourself permission to take care of you as well. I love your analogy about, being able to sail the ship. But what I've learned is you got to keep it afloat first and then get your sails up and then have some sort of a plan. And you know what? You can't sail a ship by yourself. It requires, crew. And there are a few people have done it, but more than likely that they're suffering from a whole different addiction, but I think it's important to get the whole team together, and I think we really need to talk about it a lot more. So, Mike, let me ask you, what is it we haven't asked you today that we should ask you? What would you like us to ask you that we haven't?
Well, I think that to help families begin to understand, if there are people who are listening that have a loved one, I did a study where I just asked families: is living with an actively using family member traumatizing? And just wanted to see if people even had that on their radar. 97% of the families, and I think there were like 320 family members, said that they either strongly agreed or agreed. And so the first thing I would say is for family members to begin to recognize and give themselves credit for just persevering through an incredibly traumatizing thing. There's nothing like seeing your loved one begin to just be so out of control. And I think, you work with the overdoses so much, and how traumatized they are. And if they can begin to own their pain and own their struggle, it's really hard because, their first thought is, I can't worry about me, because then I can't, I don't have energy to worry about him or her, the client. So I think those are the first things, is empowering families to feel okay that, it hasn't turned out the way they wanted it to, but this is, how often do we see this? Every family I work with. I think the other thing is the chronic disease management research says that a client with a chronic disease is more likely to successfully live with that chronic disease when the family does like 5 things. Number 1 is begin to recognize that we've all been impacted, that it's a family system disease, just like you said, and that support isn't enough, that we have to move into a family in recovery. The second is we have to learn how to problem solve better, and we have to communicate better. The third is, and this is the one that's really interesting to me, is what they found was that families that begin to incorporate recovery-oriented activities into daily life. And how many times have you been asked by a family member, how much longer does he have to go to IOP? We'd like to kind of get back to normal. And the idea is, this is normal. This is as normal as it's going to get. But that when families can grasp that, and that everyone gets to get the care that they need, they tend to do better. And the last one is that when other family members begin to talk about their own recovery and what they're doing for, I didn't realize I was depressed for the last 20 years. I'm really feeling better now. And so in our program at the Foundry, and we're getting ready to market this. I've been working with Arizona State University to take my videos and to take some of my material and put it into an app form that we will use and others will use. That the clients get the same lectures that the families get every week. And so that when they're on their 20-minute phone or 10-minute phone calls, rather than complaining about something, the parent can say, let me tell you what I'm learning. And it's blowing my mind how much work I have personally to do. And so clients get angry at their families for participating because they feel shame. It's like, you don't have to do this. I'm going to be fine. And so we work with families to not say, I'm doing this because I love you and I want to support you. That just keeps the client right in the identified patient role. I'm doing this for you. And the other, what we're really helping families kind of begin to have conversations about is, I'm really learning that I need it as much as you need it. And the goal is to take the client out of the identified patient role and move them into a family in recovery where everyone's growing and everyone's willing to look at their own part in it. And again, that's what the chronic disease literature says, when the family can do that.
So what's the best choice of wording? Is it, we're going to do this together, I'm going to work with you, we need to work on this together, I want to be part of your process, but I got to be part of mine as well? How would you frame that? What would be a simple soundbite around that?
Well, I think you said it best earlier. I'm realizing this is a family disease and we all have it, and that I have a lot of work to do. And, the thing we haven't talked about is like family of origin work and historical trauma. And Fred was talking about how we have this image of people with addiction in this very negative way, and, like the town drunk kind of thing. Well, I think it's just as much about, you're acting like my father acted when he was drinking. And there's just this, and again, the chronic disease folks have really nice models of looking at how family history impacts how families understand illness and how they understand addiction and how they understand trauma, and which either promotes growth or prohibits growth. And so I think that piece of helping the families that come to be willing to look at maybe the life they grew up in wasn't all that great either, and maybe they've done the best they can, but our belief is that the more families are willing to look at history, and the more they're willing to kind of come to terms with, this started a lot longer ago than when my son started drinking at 9, and we've done the best we can. So I think the terminology is always at best about, we all have this, and we all are going to need to work on it. And so I'm not doing this for you. It's so interesting. I was talking to a mom, and her son came home from treatment, and she was going to Al-Anon. She was really doing it. And one night she had planned to go to a meeting. She needed to go to a meeting, and her son came home from work and said, I decided not to go to a meeting tonight. Let's you and I go get dinner. Just relax and have some fun. And she said, okay. And I said, well, what would have happened if you had said, I need a meeting tonight. And I know you decided you don't. I do. Maybe if we can have a dinner after my meeting, that would be great. But what a message to send that says, I'm not doing this for you. I'm doing this for me. And by doing this for me, it makes our family stronger. So that's the message.
That's good. That's great. In closing here, before we end this thing, I think you're fantastic what you do and stuff, and you're so well spoken, and you could tell you truly believe what you believe. You're speaking your truth. So we appreciate that. And I'm sure Scott does. I see an enlightenment in Scott. I've known Scott years now, so I see when he's, for lack of a better word, turned on or turned off. I've seen it in both. That's happy Scott right there. Believe it or not, that's happy right there. So he sees a lot. See, I get to smile out of him. But I wanted to clarify one thing. Your son is fine today.
Oh, yeah. He's 37 years old. He's doing great.
And he recovered completely from it.
Yeah, it was a miracle.
Amazing.
How bad it was. Yeah.
Okay, well, we want to thank you for being on. Is there anywhere people could reach out to get a hold of you?
Get your book.
Probably the easiest is email, and it's mike.barnes@nrtbh.com.
And I'll put that in the show notes. What's the name of your book in case people want to look for it?
Called When the Solution Becomes the Problem, Helping Families Struggling with Addiction and Trauma.
Okay, excellent. Is it doing well? How'd it do? Pretty good?
It's doing okay. It's
tough business. We're all in it. I'm a writer. He's a writer. You're a writer. It's a tough business. Marketing is tough, but we want to thank you for being on. Hopefully you'll join us again anytime. We'll reach out to you. I enjoyed it. I'm sure you could help us. We like to build a friendship so we have somebody to always reach out to if it's in your expertise, and we could bounce questions off you if you're willing to help. We'd appreciate that.
Yeah, I'd love it.
Okay. Well, that's going to be it, Scott. That's it for your crisis coach. You want to sign off, or you want me to sign off?
No, I'll let you sign. I just want to thank Mike.
You like hearing me say it. That's it. Okay, everybody. This is your crisis coach with Scott H. Silverman and Fred Carroll. And if no one has told you they love you today, we love you, and we will see you again next week. Thanks for joining us. Goodbye.